Hello and welcome to Elevated Healthy, the platform that launches the steps to health literacy and retirement planning. My name is James Price, and that's right, I specialize in helping seniors navigate important life decisions related to health, financial planning, and Medicare. Going on 4 years now. I love setting up educational sessions, and I know how important it is that you get the information that's beneficial to you. So, the topic that we're going to break down today is the terminology of Medicare. As you know, you get lots of paperwork and you see all these terms, and they can perhaps be overwhelming. Well, I'm here just to give you some insight to perhaps some of the terminology you might see on some of your health insurance plans, whether you have Medicare or just health insurance in general. So allow me to just go through some of these key terms with you so you can better understand how these important terms you can be able to decipher when it comes to what's important when it comes to your health plan. All right. So, annual election period. You may have heard that, seen that on commercials. The annual election period, if you have Medicare, begins October 15th and ends December 7th. Now, during the AEP, you can enroll in or disenroll from or change your Medicare Advantage plan or your prescription drug PDP plan. You can also return to original Medicare. Elections made during the annual enrollment period are effective January 1 of the following year. So let's say it's October 15th, you decide to change your plan. It's going to go into effect on January 1, unless you may have maybe a special enrollment period that allows you to advance and enroll into that plan the following month. Now, another key term I want you to take note of is the annual notice of change, ANOC as an abbreviation. Now, this notice is sent each September by Medicare Advantage plans to members, notifying them of changes in their coverage, cost of services in the coming plan year. So don't throw that away. That's one of the things you want to keep. I know perhaps you get a lot of mailings, marketing material, whatnot, but the annual notice of change is a document that you want to take some time out to review. And if you like some assistance with that, there's plenty of people like myself. Reach out to me. I love to be able to help you decipher what you're reading so you rather know where to stick with what you have or maybe make some necessary changes to your health plan. Right, another key word, co-insurance. That's co-insurance. Now, co-insurance is a percentage of your medical and drug costs that you may be required to pay as your share of cost for medical services or supplies. For example, 20% of the cost of a prescription drug. It's co-insurance. So when you see that on your plan, co-insurance, you now know that's a percentage of your medical and drug costs that you may be required to pay as your share of cost for medical services or supplies. Now, copayment, this is a specific dollar amount that you may be required to pay as your share of the cost for medical services or supplies. For example, a $10 copay for a doctor's visit. So your plan may cover their share of the cost, but you have a copay of this amount. So you see, that word co-payment, perhaps next to something called like a primary care specialist visit, then that is a specific dollar amount that you may be required to pay as your share of the cost for medical services or supplies. Credible prescription drug coverage. Kind of want to break that down. Now, this is coverage from another source. Let's say you're working, such as employer benefits, and you got drug coverage that is deemed credible through that employer benefits that you receive. That is equal to or better than Medicare Part D prescription drug coverage. Credible prescription drug coverage. You may have heard that term. That is what they're referring to. If you may have prescription drug coverage outside of your Medicare coverage, perhaps you have credible prescription drug coverage. Now, the deductible, you see this word a lot. It's a very important term. The deductible is the amount you pay for medical services or prescription drugs in a plan year before your plan begins to pay for benefits. So when you look at your summary of benefits or your annual notice of change, perhaps keeping an eye out for the deductible, the amount you pay for medical services or prescription drugs in a plan year before your plan begins to pay for benefits can be a deciding factor on whether you want to stick with what you have or make a necessary change. Because our goal is to make sure you're taking those elevated steps to health literacy and understanding what you need to do to make important and informed decisions when it comes to your health plan. Now, the evidence of coverage, really nice book to read if you're a bibliomaniac or something just like to read. Well, you'll definitely like to read your evidence of coverage document. Now, this document lists in detail your Medicare plan, plan's benefits and costs. That document that you receive, this thick booklet, evidence of coverage, lists in detail your Medicare's plan, benefits, and costs. I've actually read a couple of evidence of coverage books, and it's it gives you a lot of detail about your plan, like maybe the infrastructure, the nerves, the tendons of your plan, if I can put it in a metaphorical sense. It's gonna give you the anatomy of how your plan operates. Drug list, also called a formulary. Okay, formulary will be perhaps a more standout word. Perhaps may have heard agents or seen documentation that has that word drug list or formulary. What that is a drug list details specific medications or drugs covered by a prescription drug plan. It's often divided into sections or tiers, like tier 1, tier 2, tier 3, tier 4, tier 5, tier 6, based on the amount each plan will pay for the drugs in that group. Very important to consider with your plan, the formulary, the medications, if you're prescribed any, to make sure that they are being covered. And when you receive an annual notice of change, that'll be one of the things that you can keep an eye on is the formulary, the drug list. Very important to consider when it comes to your health plan, especially if you are prescribed medications. Wonderful word that you see often. It has abbreviation. It's known as HMO, but it stands for Health Maintenance Organization. Health Maintenance Organization. This is a type of health insurance plan where a primary care physician arranges your health care using providers and the plan's network. What does it mean to have an HMO? You have access to healthcare providers using a network where you may have a primary care physician that assign you specialists or the physicians, providers that coordinate your care, depending on the type of HMO plan that you have. If you perhaps go outside of your network, perhaps neither Medicare nor your plan will provide assistance with the payment if that provider is not within that network of your HMO. Very important to always confirm, look up your providers if you are accustomed, and just double checking to make sure that if you have a health maintenance organization, HMO, that these providers that you are seeing for your healthcare are within that network if you have an HMO. So just want to make sure you're aware, health maintenance organization, HMO, is a type of health insurance plan where a primary care physician arranges your healthcare user providers in the plan's network. Perhaps if you want to have flexibility to send doctors of your choice, then a PPO is a plan that I'll highlight in just a moment for you and explain what that means. Now, initial coverage election period. ICEP is a 7-month period when a Medicare eligible person can sign up for Medicare for the first time. It begins 3 months before your 65th birthday and includes your birthday month and 3 months after. Initial coverage election period. To put it more simplistic, let's say you end up getting your Medicare card in the mail. Your birthday is, hypothetically, let's say your birthday is in not September, we in September. But let's say your birthday is in December, right? So you have 3 months before your birthday or your birthday month to choose how you want to receive your Medicare benefits, whether it's through a Medicare Advantage or perhaps a Medicare supplement. Then you have the month of your birth month to make a decision on how you want to receive your, whether it's through original Medicare, prescription drug plan, and then you have 3 months afterwards of your birthday to make that decision. That is what the initial coverage election period entails. And for more information about that, I love it. If you need a one-on-one consultation, that's what I'm here for as well. Medicaid, you may have heard this, some states have nicknames for Medicaid. You may have things like TennCare, what's another one? TennCare, you got Healthy Connections, Mississippi Can, things of that nature, right? So these are jointly funded by federal and state dollars. Medicaid provides health coverage for certain low-income people. It may include pregnant women, the elderly, and those with disabilities. When you have both Medicare and Medicaid, that can make you dual eligible, and those are benefits that are tremendous to a person who, like it mentions, for certain low-income people, it may include pregnant women, the elderly, and those with disabilities, really assist with on some of the costs that Medicare doesn't cover. And the Medicare Advantage, like all in one, has a contract with Medicare to provide you with your Part A, your Medicare Part A, and Medicare Part A, part of original Medicare. This helps cover inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care, right? So Part C, as is also called, a Medicare Advantage plan, is going to provide you with that, as long as it's contracted through Medicare. Then Part B is also going to cover your Part B benefits. So part of original Medicare, Medicare Part B, that helps cover certain doctors and preventive services, outpatient care, and medical supplies. So with that Medicare Part C, Medicare Advantage plan, these plans are offered by private insurers approved by Medicare. Now, by law, Medicare Advantage plans must offer at minimum the same benefits as original Medicare Part A and Part B. And we were talking about those benefits. Most Medicare Advantage plans also include coverage for prescription drugs, and many include some coverage for dental, vision, and hearing care as well. So if you're looking for perhaps like a more all-in-one structure to your health plan, then there are Medicare Advantage Part C plans that exist. Now, Medicare Part D, you may have seen that or heard that Part D is insurance for prescription drugs sold through private insurance companies. Part D can be offered in two ways. Number one, as Part D coverage combined with the Medicare Advantage plan. So we go back to Part C, where it can provide you Part A, Part B, as well as Part D, all under one plan. As a standalone, number two, you can get Part D as a standalone prescription drug plan. So perhaps original Medicare, Part A and Part B, along with a Part D plan, or original Medicare, you have like a Medicare supplement, and then a prescription drug plan, just to give you examples of how you can obtain them. And that leads me to Medicare supplement insurance, also called Medigap insurance. Medicare supplement insurance is sold by private insurance companies to help cover out-of-pocket costs not paid by original Medicare, such as copays and deductibles. It does not include coverage for Part D prescription drugs. So that's why when I was mentioning two ways to get prescription drug coverage, as a standalone prescription PDP plan is how you can obtain that if you get a Medicare supplement insurance plan. Network, okay? We talked about a network earlier when you have a health maintenance organization. But to put it more direct, a network is a group of healthcare providers who have agreed to provide care based on a plan's terms and conditions. These providers include doctors, hospitals, and other healthcare professionals and facilities. With most plans, you'll save money by using an in-network provider. So a network with most plans will be able to save money by using in-network providers who will contractually agreed with that network to provide you with service. Medicare Advantage open enrollment period. Okay. The annual enrollment period, you decide to get a new plan, or perhaps you didn't decide to change your Medicare Advantage plan during the annual enrollment period. There is the Medicare Advantage open enrollment period. This option is for people enrolled in Medicare Advantage only. It runs each year from January 1 to March 31st. Now, during this time, Medicare Advantage members can switch to another Medicare Advantage plan or return to original Medicare. So the Medicare Advantage open enrollment period, OEP, if you have a Medicare Advantage plan, this is an option for people enrolled in Medicare Advantage only. It runs each year from January 1 to March 31st. So if you decide to change your plan on March 31, it would perhaps go into effect April 1st. And during this time, Medicare Advantage members can switch to another Medicare Advantage plan or return to original Medicare if you want to drop what you have as a Medicare Advantage plan. You can do it through this time period and return back to original Medicare. Now, original Medicare, that's also called traditional Medicare. Original Medicare consists of Medicare Part A, which is the hospital benefits we're referring to, and Part B is the medical coverage. It is offered directly by the federal government. Ways that you get Medicare is if you have paid those 40 quarters into the Medicare tax, then you are entitled to Medicare. Part A, premium free. Part B does come with a premium. When you have both Part A and Part B, that makes you eligible for Part C, Medicare Advantage plans. Now, I want to highlight what out-of-pocket cost means. Now, out-of-pocket costs, you may have heard this term before. These are any costs you're required to pay for medical care, prescriptions, and other healthcare services, including coinsurance, co-payments, and deductibles. Medicare Advantage plans are required to set an annual maximum out-of-pocket limit, after which you pay nothing for covered care. So if you happen to look over your summary of benefits or annual notice of change and you happen to see something what they call a maximum out-of-pocket responsibility, that is saying in the event you have perhaps a really catastrophic year, really under the weather, your medical costs will not exceed this limit. Because if you ever reach that maximum out of pocket that your plan is set for you, then that plan, you wouldn't have to pay for your Part A and Part B services that you receive in the event that you reach your maximum out of pocket for the remainder of that calendar year. Some plans offer, little small maximum out of pocket, just depends. But it's a good thing to look at when you are researching a plan that you want to make sure it's right for you. Now, a preferred provider organization. We talked about the HMO. Now we're going to highlight the PPO. This is a type of health insurance plan that gives you the freedom to choose your own doctors and hospitals. And your out-of-pocket costs are usually lower if you choose your healthcare providers that are in the plan's network. So with a PPO, you still have that network of providers. However, you are able to still see providers not within your plan's network, usually at a perhaps higher cost than what an in-network provider would be. So just want to keep that in mind. When you're choosing a PPO, you have that flexibility of choosing your own doctors and hospitals. Your out-of-pocket costs are usually lower if you choose healthcare providers that are in the plan's network. Now, the premium is the amount you are required to pay each month to Medicare or your private insurance carrier for your healthcare coverage. So when you see your plan or the summary of benefits or annual notice of change, keep in mind and look at the premium. The premium is the amount you are required to pay each month to Medicare or your private insurer for your healthcare coverage. Provider. This is anyone who provides you with medical goods and services such as a doctor, nurse, hospital, or durable medical equipment provider. Durable medical equipment like wheelchairs, diabetic shoes, CPAP machines, just to give you examples of durable medical equipment providers. All right. Special Needs Plan, SNP. And you might have seen this or heard this, or maybe talked with some friends or family, mentioned something about a special needs plan. These Medicare Advantage plans include all Medicare Part A, hospital, Part B, medical, and Part D, drug benefits, and may include additional benefits such as support for chronic condition or services that may be helpful to someone who has both Medicare and Medicaid. To qualify for a special needs plan, you must have Medicare Parts A and Parts B and meet one of the following conditions. A, you have a chronic illness that is verified by a doctor, like a chronic special needs plan. Or B, you receive Medicaid assistance from the state that make you eligible for a dual special needs plan. Or C, you live in a long-term care facility. So long-term care facilities you live in that are institutional special needs plan that may be suitable or can help in your situation. All right. So I do hope that this video gives you some elevated, healthy insight and help you understand some of the definitions of common Medicare terms or health insurance terms that you may see from your summary of benefits or your annual notice of change coming forward. And if you like a one-on-one consultation, I'd be more than happy to be that resource, a person that you can trust. I've been doing this for 4 years now, and I look forward to every day I'm able to help seniors know more and be more informed and empowered with the decisions they make. My name is James Price. I do thank you for watching the video. The name of this channel is called Elevate Healthy, where we guide seniors to taking those steps of elevation to a healthier lifestyle. Thank you for your time, and I'll see you again.
Come be a part of our community. Secure 65 health plans. The Love and Trust Tour and the Reassurance Tour are going on right now. Join us. We are the vision. We are disruptors, and we're changing the way seniors do business. Become one of us. We are your community, and we are here for you. No senior should ever enroll in Medicare with a stranger. Call us today at 213-394-8885 or 833-300-4968 or email us at info@mybivix.com. Secure 65 health plans where seniors thrive.